First tonight, an insight into our losing battle that is elective surgery. Life-saving materials are sitting in warehouses as patients wait in pain. And with the flu season just around the corner, surgeons are crying out for help.
We just cannot stop elective surgery.
You feel a little bit let down by the system.
These belong in patients, not in bins.
There's been so many shocks to the system.
Like most surgeons, it's her patients that keep Dr. Payal Mukherjee going.
For a surgeon, you'd probably say, you need to do what you need to do. You know, you start when you need to, you finish when you need to.
And the need has never been greater. Dr. Mukherjee and her colleagues are working around the clock to clear a backlog of elective surgery.
They're incredibly stressed, and we're seeing, mental health issues, suicide. So we just cannot, you can't just sort of, keep working at 110%.
So I perform in the order of 400 hip and knee replacements a year.
Dr. Matt Lyons has his work cut out for him on the back of 2 elective surgery bans in New South Wales.
I have about 150 patients waiting for their surgery, having already come to see me being in pain, having a severe impact on their quality of life.
I'm finding it difficult to walk any distance and great difficulty going upstairs.
Today, it's finally Carleen Holland's turn after her surgery was postponed twice. The 76-year-old grandmother is having her double knee replacement fixed.
This waiting, I mean, what sort of toll has it taken on you?
I've just had to be patient. We've all got to be patient. Can't bring it forward.
Well, it's just very disappointing, very disappointing. Hello, Doctor.
Glenn Davis gave up after 2 years on the public wait list to have his sinus surgery.
When they rang me saying, that they've cancelled me twice, I just think, well, what's it like out there for other patients as well? I mean, I'm not the only one, I think it's quite horrendous, actually, to be quite honest.
The battle to catch up is relentless. Cases once considered not urgent are suddenly having to be bumped to the front of the line.
Elective surgery is not unnecessary surgery. They're all booked for a reason. But if you push them back 1 year, 2 year, 3 year, there will be an impact that they have to get because their disease conditions have progressed.
And perhaps even more painful is what's happening inside this warehouse.
So Dimity, this is our central warehouse where we have many of our implants that are servicing surgeries all around Australia.
Aisles of new hips and knees ready to be scanned and delivered to hospitals.
Patients who need these, their mobility is severely impacted. Likely their lifestyle has become quite sedentary, they're not exercising.
Johnson & Johnson's Sue Martin shows us another devastating loss when elective surgery is put on hold.
All of this stock has expired. So, for example, this is a hip that will now be disposed of. This is a knee insert which will now be disposed of. And so an unfortunate result of not going into patients.
This would mean so much to people sitting there in pain.
Well, it would. And ideally, those patients are going to be treated very, very soon because the pausing of elective surgery has had a huge impact on patients.
The latest figures suggest across Australia, more than 250,000 patients are currently waiting for elective surgery. 94,000 are in New South Wales. Just over 80,000 are in Victoria. Close to 58,000 are waiting in the queue in Queensland. In Western Australia, over 28,000. Almost 17,000 in South Australia, while 4,362 patients are waiting for elective surgery in the ACT.
But if you keep delaying non-urgent cases over and over and over again, there is a real consequence.
With winter around the corner, medicos are bracing for what's to come.
So if we're seeing, more cold and flu complications plus COVID, a new variant of COVID, especially if it's severe, then it's going to be very stressful.
There are grave fears elective surgery will be suspended yet again if the health system buckles under the pressure of our first flu season in 3 years.
Repeatedly we're seeing is our weakness is workforce. We really need to surge our workforce in the public sector to brace for winter.
How do you do that? Do we have enough time? Are there enough people to physically do the job?
We can use some of the workforce that's in the private sector only to surge the workforce in the public sector without compromising the care in the private sector.
Victoria recently announced a $1.5 billion post-pandemic surgery blitz, turning Frankston's private hospital into a public surgery facility to help clear the chronic backlog.
Without doing something differently, we're going to have a lot of patients in pain.
Catholic Health Australia's Policy Director, Caitlin O'Dea, says the public and private health sectors need to work together across the country.
We are well placed, we are here, we want to have dialogue with government, public hospitals and departments to develop a long-term strategy to treat the enormous elective surgery backlog.
Doctors are also calling for better leadership by the federal government, whoever that might be after the election.
There's been somewhat a knee-jerk reaction and a lack of coordination and communication with the health practitioners and in turn to the public.
Vaccination period for last year was the worst that we've been through. We're seeing the same in terms of workforce planning. We really need the federal government to boost us with...
And while they wait for the support they need, they have no choice but to just keep going.
Everyone's tired, but I think the two things that keeps you going is the patients and the fact that they're getting better. But the other thing that also keeps you going is you're not alone. It just amazes me how much goodwill there is for everybody to work together to keep going.
Let's hope a solution is found soon.